Hi, everybody. Dr. Nikita Vizniak here with the amazing.
Dr. Catherine Chung.
And today we're going to be going through an anti-inflammatory diet. So, just on a
Mhm.
superficial level, what is an anti-inflammatory diet used for?
It's for people that have a lot of inflammation, and that can be due to joint pain, that can be due to cardiovascular issues, a lot of brain inflammation. So, we're looking at migraines, headaches, seizures. So, anything that is worsened by inflammation, the anti inflammatory diet will play a wonderful role in.
Okay, excellent. So, what are some of the key things that we should know for the anti-inflammatory diet? Like the first thing is people always talk about this diet as a kind of a go-to for a lot of patients to start with. When would you know that this might actually offer you some benefit?
You'll know it when your patient describes that they just constantly every day have this achiness or this stubbornness in their symptoms, and they've tried all these things, they've tried medications, and they just don't know where to go. And
Mhm.
that's why anti-inflammatory diet seems to be the easiest because inflammation, systemic inflammation, you deal with that every day. And if your body just can't handle it, then it's this is why it's like the go-to one for
Yeah, and
that.
the systemic inflammation leads to symptoms that wind up being body wide and influence
Mhm.
things like sleep, activity level. Like this, just chronic inflammatory process really decreases somebody's overall quality of life, right?
Correct. And when you're looking at the therapeutic uses here on this page, you can see a lot of them are conditions that are lifestyle based, right? You got heart
Yeah.
disease, diabetes, and weight loss, and chronic pain. All of those things have a lifestyle component to it, and the anti-inflammatory diet is just the way to start until
Okay.
you figure out what else is going on. You know.
Yeah, absolutely. So this is a foundational change you can make in your overall health to help people feel better right here. So what are you basically looking at for an anti-inflammatory diet? I'm pretty sure you're looking at as unprocessed and whole foods as much as possible, correct?
Pretty much low or no sugar. Honestly, I just tell my patients there's absolutely no way you're going to go no sugar. So
Mm-hmm.
if you can go low as much as possible and you choose the healthier sugars in general, then that would be the best way to go. But you're just exactly what you're saying. You're reducing the allergenicity of those foods, and then you're improving the fresh ones that are going to not inflame you so much.
Yeah, and we're so again, those refined carbohydrates, those are going to be the killers. That chocolate bar, those potato chips for your hydrogenated oils and trans fats and all that kind of stuff. Anything
Mhm.
you can do to reduce, even potatoes and tomatoes, might be something you want to take out of the diet a little bit.
Yep,
And
as a general, the nightshade families tend to be quite inflammatory for most people,
mhm.
which is like the eggplants and the potatoes and the tomatoes, all the fun stuff.
Yeah, exactly. And some people are kind of surprised by wheat and cereals, whole wheat pastas as well, being eliminated from the diet when most people think, well, it's whole wheat, it must be good for me.
Yeah, wheat is wheat.
Yeah,
Um,
yeah.
no matter if it's like a processed wheat or a whole wheat, it doesn't really matter. It's usually the protein that's the wheat protein itself or the gluten inside the wheat that's the issue.
Yeah. All right. Okay, so then we can go ahead and see here other things like meat, pork, even seafoods like shrimp. Okay, dairy products, milk and cheese are going to be eliminated.
Mhm.
And of course, even the drinks. A lot of people don't even realize how much sugar is in a drink when they're having it, right? So,
Yeah, exactly. And with coffee on there, technically coffee is okay. It's
mhm.
all the stuff that we add to coffee that's more the issue, right?
Super good
So,
point. A lot of people will be very glad to hear that point right there.
yes.
All right. So when we look at these therapeutic uses, we kind of already went over it. Heart disease. We can talk about, how olive oil decreases, stability of coronary artery disease, all kinds of other things that happen with this. Diabetes and hypertension, though, those are two big issues that we are seeing in North America right now. For sure, that can be influenced by this.
Mhm.
Of course, prostate cancer for men is going to be another big one. Additional benefits, though, anywhere that's going to knock down this chronic inflammation can potentially have benefits. So, a lot of our autoimmune and inflammatory conditions can be improved with this anti inflammatory diet. Maybe you could elaborate on that a little bit more for us, Dr. Chung.
Yeah, well, that makes sense because a lot of the inflammatory processes is part of your immune processes at the same time, right? So we saw that with the when we were chatting about the low histamine diet and how the histamine gets released, and then it causes a lot of swelling and increase in blood circulation, and then that will kind of increase systemic flow of inflammatory markers. So
Hmm.
if we work on the systemic inflammation and we can then that will have an effect on the immune system, which is why a lot of the autoimmune diseases are on that list of additional benefits.
So would I have the potential to fully reverse a condition or mainly just reduce symptoms of the conditions?
Unfortunately, or fortunately, I guess how you see it, you won't be able to get rid of an autoimmune condition, and it's usually because it is very genetic based. However, you can deal with it and keep it in remission. That is the ultimate goal.
Hmm. Absolutely. And then, mitigate the symptoms as much as possible. And I think one of my
Correct.
favorite quotes from the research right here was this one. If you want to live a long, healthy life, you must keep your inflammation as low as possible.
Correct.
All right. Is there anything else you would add for an anti-inflammatory diet that we should be aware of, the amazing Dr. Chung?
I would say this one is a great starting point. However, we still have to look into why the inflammation is there. A lot of my patients, if there is a hormonal issue, or even if they're exercising too much, like they're going a little bit too intense and they're not allowing themselves a recovery time, that will be causing a lot of inflammation too, or even cortisol and stress. Because remember that cortisol is an anti-inflammatory on its
Hmm.
own. However, if you go into HPA dysregulation, which means that your cortisol levels are kind of all up and down and all wonky, then you're losing that anti-inflammatory property of the cortisol itself, right? So getting to the key of, okay, there's the diet, but then there's all these other things that the diet won't necessarily touch is also a really important aspect. So don't try the anti-inflammatory diet for 3 months and then just and not change anything else or look into anything else and then
Hmm.
be like, oh, that didn't work, so inflammation's not an issue. We just have to do a little bit more digging and figure out what else is going on.
Yeah, exactly. And try and give a more tailored, patient specific interaction for the best outcomes that we can see for them. All right,
Mhm.
excellent. And then what would you say for this diet? You mentioned 3 months. How long should you be trying this diet for before you can tell if it's giving you results or not? I mean, just on a simple level, adopting this diet will give results for everybody, but it'll vary on the amount that you actually experience with it, correct?
Yes, yeah. And generally, I say with any diet, give it 3 months for sure. I believe I was reading an article that was saying that it takes 3 months for every molecule of each of the foods to be completely out of your system.
Mhm.
So and then you start fresh from there. So that's why it's the 3 months.
Yeah, excellent. All right. Well, thank you very much, Dr. Chung. Fantastic to have your input on this one. And we look
Yeah,
forward to
thank you for
seeing you in the
having
next
me.
video.
Yeah, for sure.
All right.
Bye.
Bye, everybody.